Paranoia, understanding the intricacies of an overarching suspicion. Paranoia, at its core, is the pervasive sensation of being under threat, characterized by a belief that external entities are monitoring, conspiring against, or acting in opposition to the individual, even in the absence of substantiating evidence. This phenomenon is not uncommon, affecting a considerable number of individuals at various points in their lives. While occasional paranoid thoughts are a normal part of the human experience, clinical paranoia represents a heightened and persistent form of this mental state. Distinguishing anxiety from paranoia. Paranoid thoughts are inherently linked to anxiety, with the latter often serving as a catalyst for the former. It is vital to recognize the distinction between normal anxieties, which arise in response to life events such as job loss or relationship endings, and clinical paranoia, wherein individuals are unequivocally convinced of the reality of their suspicions despite contradictory evidence. Symptoms of paranoia. Clinical paranoia manifests through a range of symptoms, including defensiveness, hostility, and aggression, coupled with an unwavering belief in one's infallibility. Individuals experiencing paranoia struggle with compromise, forgiveness, and the acceptance of criticism. Trust becomes a rare commodity, and mundane behaviors of others may be interpreted as concealing hidden meanings. Exploring the nuances of paranoia and its impact on mental well-being. Understanding the multifaceted nature of paranoia involves delving deeper into its intricacies and the broader implications it has on mental health. Beyond the surface symptoms and causes lie complex interactions between cognitive processes, emotional responses, and external factors that contribute to the development and persistence of paranoid thoughts. Cognitive distortions and paranoia. Paranoid thoughts often stem from cognitive distortions, where individuals interpret neutral or ambiguous situations as threatening. Cognitive behavioral therapy, CBT, can be an effective tool in identifying and challenging these distorted thought patterns. By addressing irrational beliefs and replacing them with more balanced perspectives, individuals can gradually regain control over their cognitive processes. Social isolation and paranoia. The defensive and distrustful nature of paranoia can lead to social withdrawal, exacerbating feelings of isolation. As individuals become increasingly convinced of external threats, they may distance themselves from friends, family, and support networks. This isolation not only intensifies the impact of paranoia but also hinders the natural social interactions crucial for mental well-being. Paranoia and psychiatric disorders. Psychiatric disorders, such as paranoid personality disorder, schizophrenia, and borderline personality disorder, often involve a spectrum of symptoms, with paranoia being a significant component. Recognizing these disorders requires a comprehensive assessment by mental health professionals. Tailored treatment plans, including medication, therapy, and support networks, play a pivotal role in managing and alleviating the impact of paranoia within the context of these disorders. Intersection of paranoia and substance abuse. The interplay between substance abuse and paranoia introduces a complex dynamic. While certain substances may induce short-term paranoid thoughts, the long-term consequences can extend beyond the duration of intoxication. Substance abuse treatment programs, alongside mental health interventions, are essential for individuals caught in the cycle of addiction and paranoia. The aging brain and paranoia. As individuals age, neurological changes, including those associated with conditions like Alzheimer's disease, may contribute to heightened suspicions. Managing paranoia in older adults requires a specialized approach that considers both the cognitive aspects of aging and the specific challenges posed by neurodegenerative disorders. Holistic approaches to paranoia treatment. A holistic approach to treating paranoia encompasses lifestyle modifications, therapeutic interventions, and social support networks. Integrating mindfulness practices, such as meditation and yoga, can aid in fostering mental clarity and emotional resilience. Additionally, cultivating healthy interpersonal relationships and engaging in activities that bring joy and fulfillment contribute to a more robust defense against the grip of paranoia. Stigma surrounding paranoia. Addressing the stigma associated with paranoia is crucial for fostering understanding and empathy. Encouraging open conversations about mental health, debunking misconceptions, and emphasizing the prevalence of mental health challenges can contribute to a more supportive and inclusive society. Distinguishing anxiety from paranoia. Navigating the spectrum of apprehension. Anxiety and paranoia, both rooted in the realm of psychological experiences, share common ground yet manifest distinctly. It is imperative to discern their nuanced differences to facilitate accurate identification, understanding, and subsequent intervention. Foundations of anxiety. Anxiety, a ubiquitous human emotion, arises in response to real or perceived threats. It is a natural, adaptive mechanism designed to heighten awareness and prepare the body for action. Occasional anxiety is a normal part of life, triggered by stressors such as work challenges, relationship issues, or significant life changes. Paranoia defined. Paranoia, on the other hand, represents a heightened state of apprehension, characterized by an unwarranted belief in the existence of external threats. Unlike anxiety, paranoia tends to be more pervasive, involving a persistent conviction that others are conspiring, watching, or acting against the individual, even in the absence of concrete evidence. Intensity and duration. One key distinction lies in the intensity and duration of these emotions. Anxiety often ebbs and flows in response to specific stressors and tends to dissipate once the stressor is addressed or resolved. Paranoia, however, can endure for more prolonged periods, coloring a person's perception of the world consistently. Rationality versus irrationality. While anxiety may have a rational basis tied to specific stressors, paranoid thoughts are often irrational, detached from reality, and resistant to contrary evidence. Anxiety is a response to a genuine external threat, whereas paranoia involves an exaggerated perception of threats that may not align with objective reality. Impact on functioning. Anxiety, when within normal bounds, can serve as a motivator for problem solving and adaptive coping. However, persistent and severe anxiety may interfere with daily functioning and warrant intervention. Paranoia, by contrast, can significantly disrupt interpersonal relationships, hinder social engagement, and lead to isolation due to an overarching distrust of others. Relationship dynamics. Anxiety often involves a self-centered focus on personal concerns and potential future challenges. In contrast, paranoia introduces a heightened external focus, with the individual actively suspecting malevolent intentions from others, even in routine interactions. Clinical considerations. Clinical anxiety disorders, such as generalized anxiety disorder or panic disorder, involve excessive worry and fear. Clinical paranoia, on the other hand, may be indicative of conditions like paranoid personality disorder, or certain aspects of schizophrenia spectrum disorders. Seeking professional guidance. Given the complexities in distinguishing between anxiety and paranoia, seeking professional guidance is crucial. Mental health professionals can conduct thorough assessments, considering the context, duration, and impact of the emotional experiences, to formulate an accurate diagnosis and implement appropriate interventions. Potential causes of paranoia. Sleep deprivation. A chronic lack of sleep can contribute to the development of paranoid thoughts, impairing cognitive function and distorting perceptions of interpersonal interactions. Adequate sleep, ideally 7 to 9 hours a night, is crucial for maintaining mental alertness and well-being. Stress. Elevated stress levels, whether stemming from negative events or positive occurrences like weddings, can heighten suspicions of others. Various stress management techniques, including relaxation, socializing, laughter, exercise, and meditation, can help alleviate such tensions. Psychiatric disorders. Conditions like paranoid personality disorder, schizophrenia, and borderline personality disorder may contribute to persistent paranoid thoughts. Seeking professional assistance is essential for accurate diagnosis and tailored treatment plans. Drug use. Substance abuse, particularly with drugs like marijuana, hallucinogens, and stimulants, can induce short-term paranoia. Prolonged alcohol abuse may lead to ongoing paranoia and hallucinations, exacerbating existing mental health issues. Memory loss and dementia. Neurological conditions, such as Alzheimer's disease, can alter cognitive function, fostering suspicion and paranoia. Managing symptoms requires specialized care and support. Paranoia treatments. For individuals sensing a detachment from reality, consulting with a doctor or mental health professional is imperative. Implementing lifestyle changes, such as maintaining a balanced diet, regular exercise, and sufficient sleep, is foundational for mental well-being. Engaging in constructive self-talk can assist in managing paranoid thoughts. Acknowledging the implausibility of these thoughts and reframing them realistically is a crucial step in regaining mental equilibrium. In cases where irrational thoughts hinder daily functioning, seeking assistance from social workers, psychologists, or psychiatrists is advisable. Talk therapy and medication may be recommended to alleviate symptoms and facilitate a return to a more balanced mental state. Coping mechanisms and cognitive patterns. Understanding how individuals cope with anxiety and paranoia sheds light on their distinctive nature. Anxiety often leads to problem-focused coping strategies, where individuals seek solutions to the perceived threat. In contrast, those experiencing paranoia may resort to avoidance strategies, withdrawing from social interactions, or adopting hypervigilant behaviors to protect themselves from perceived threats. Triggers and catalysts. Exploring triggers for anxiety and paranoia unveils additional disparities. Anxiety tends to be triggered by tangible stressors, whereas paranoia can be ignited by internal thoughts or external cues that may seem innocuous to others. Recognizing these triggers is pivotal in tailoring interventions that address the specific dynamics at play. Impact on social perception. The impact of anxiety and paranoia on social perception is noteworthy. Anxiety may lead to a heightened self-awareness and concern about others' perceptions, potentially driving individuals to seek reassurance or validation. Paranoia, conversely, engenders a mistrustful lens through which individuals interpret the motives and actions of those around them, often leading to strained relationships and social withdrawal. Reality testing and insight. An essential aspect of distinguishing between anxiety and paranoia is individuals' ability to engage in reality testing and gain insight into their emotional experiences. Anxiety typically allows for a level of insight, where individuals can recognize the irrationality of their fears. In paranoia, a lack of insight may prevail, with individuals vehemently defending the validity of their suspicions despite evidence to the contrary. Developmental and environmental influences. Examining the developmental and environmental factors that contribute to anxiety and paranoia provides a comprehensive understanding. Childhood experiences, trauma, and environmental stressors can shape the manifestation of anxiety disorders. Paranoia, in some cases, may have roots in early attachment issues or experiences that foster a pervasive sense of mistrust. Multidimensional treatment approaches. Tailoring interventions to address anxiety and paranoia necessitates a multidimensional approach. Cognitive behavioral therapy, CBT, is often effective in treating anxiety by challenging irrational thoughts and modifying maladaptive behaviors. For paranoia, interventions may include cognitive restructuring, social skills training, and fostering a therapeutic alliance to encourage trust and open communication. Educational and supportive strategies. Promoting awareness and understanding of anxiety and paranoia within communities is crucial for destigmatization and early intervention. Educational initiatives can empower individuals to recognize signs, seek help, and foster empathy for those experiencing these conditions. Supportive strategies, including peer support groups and community resources, play a pivotal role in creating a compassionate environment. Resilience and recovery. Emphasizing the potential for resilience and recovery is essential. Both anxiety and paranoia, when addressed through timely and appropriate interventions, allow individuals to regain a sense of control over their lives. By fostering coping mechanisms, enhancing self-awareness, and cultivating a supportive network, individuals can navigate the spectrum of apprehension towards a path of resilience and recovery. FAQ: Understanding paranoia and anxiety. What is paranoia? Paranoia is a pervasive sensation of being under threat, characterized by a belief that external entities are monitoring, conspiring against, or acting in opposition to the individual, even without substantiating evidence. How is clinical paranoia different from occasional paranoia? Clinical paranoia is a heightened and persistent form of paranoia, where individuals are unequivocally convinced of the reality of their suspicions despite contradictory evidence. Occasional paranoia is a normal part of the human experience. How is anxiety linked to paranoia? Anxiety often serves as a catalyst for paranoid thoughts, while anxiety can be a response to real or perceived threats. Paranoia involves an unwarranted belief in external threats, often detached from reality. What are the symptoms of paranoia? Symptoms include defensiveness, hostility, aggression, an unwavering belief in one's infallibility, difficulty compromising, forgiving, accepting criticism, and a pervasive lack of trust in others. How does paranoia impact social relationships? Paranoia can lead to social withdrawal and strained relationships. The mistrustful lens through which individuals interpret others' motives hinders natural social interactions crucial for mental well-being. Are paranoia and substance abuse linked? Yes, certain substances may induce short-term paranoia. Prolonged substance abuse can exacerbate existing mental health issues, leading to ongoing paranoia and hallucinations. How does aging affect paranoia? Neurological changes associated with aging, including conditions like Alzheimer's disease, may contribute to heightened suspicions. Managing paranoia in older adults requires a specialized approach. What treatments are available for paranoia? Treatment includes lifestyle changes, such as maintaining a balanced diet, regular exercise, and sufficient sleep. Constructive self-talk, cognitive behavioral therapy, CBT, and medication may also be recommended. How can individuals distinguish between anxiety and paranoia? Distinguishing factors include the rationality of thoughts, intensity, duration, impact on functioning, and the external or internal focus of the emotions. Anxiety often has a basis in reality, while paranoia involves irrational thoughts. What role does cognitive distortion play in paranoia? Cognitive distortions, where individuals interpret neutral or ambiguous situations as threatening, often contribute to paranoid thoughts. CBT can help identify and challenge these distorted thought patterns. Conclusion: navigating anxiety and paranoia. Understanding the complexities of anxiety and paranoia is crucial for accurate identification and effective intervention. Paranoia, marked by unwarranted beliefs in external threats, poses challenges to mental well-being, impacting relationships and often requiring specialized treatment. Distinguishing between anxiety and paranoia involves recognizing differences in rationality, intensity, duration, and impact on functioning. Holistic approaches, including lifestyle changes and supportive networks, play a vital role in resilience against paranoia. Addressing the associated stigma is essential for fostering empathy and creating a compassionate society. Seeking professional guidance is key, with mental health professionals guiding individuals towards recovery through tailored interventions. In conclusion, the journey from apprehension to resilience requires collective effort, awareness, and understanding. Open conversations about mental health contribute to a supportive society, ensuring individuals feel seen and supported on their path to recovery. Your health matters. Quali.health